Welcome friends to my YouTube channel Pharmacy the Novel Profession. My name is Abhishek Mohanto and today I will discuss about most important MCQ on microbiology which is important for your government exam. So let's start. First question is aldehyde test is used to diagnosis of which disease? Option A Kala-Azar, option B tuberculosis, option C diphtheria and option D syphilis. And the answer is Kala-Azar. Next question, which are the commonly known as basic dyes? Options are safranin, crystal violet, methylene blue, option D all of the above. And the right answer is all of the above. That means safranin, crystal violet and methylene blue are known as basic dyes. Next question is, which virus is first observed? Option A tobacco mosaic virus, option B mumps virus, option C influenza virus and option D smallpox virus. And the right answer is tobacco mosaic virus. Who is the father of modern microbiology? Option A Louis Pasteur, option B Paul Ehrlich, option C Waksman and option D Edward Jenner. And the right answer is Louis Pasteur, who is known as father of modern microbiology. Next question is, who is the father of bacteriology? Option A Louis Pasteur, option B Robert Koch, option C Waksman and option D Paul Ehrlich. And the right answer is Robert Koch. Question number 6. Which is the first bacteria can cause disease in human body? Option A E.coli, option B Listeria pestis, option C Salmonella typhi and option D Mycobacterium leprae. And the right answer is Microbacterium leprae. Question number 7. Which substance is used in hospital for sterilized bed, pans and urinals? Option A Cresol 5%, option B bleaching powder, option C acids and option D both A and C. The right answer is bleaching powder. Question number 8. In which concentration ethyl alcohol commonly used in hospital? Option A 50%, option B 70%, option C 90% and option D 25%. Right answer is 70%. Next, question 9. Why Ziehl Neelsen staining is done? Option A to identify acid fast bacteria, to identify gram negative bacteria, to identify gram positive bacteria and option D is both B and C. The right answer is to identify acid fast bacteria. So why Ziehl Neelsen staining is done? To identify acid fast bacteria. It is the most important MCQ. Question number 10. Which condition pasteurization is done in flash method? Option A 60 degrees centigrade for 30 minutes, option B 80 degrees centigrade for 15 minutes, option C 56 degrees centigrade for 1 hour and option D 72 degrees centigrade for 15 seconds. And the right answer is 72 degrees centigrade for 15 seconds. Question number 11. For which disease toxoid are used? Option A diphtheria, option B tuberculosis, option C typhoid, option D enteric fever. And the right answer is diphtheria. Question 12. Bacillus subtilis is used in assay of which antibiotics? Option A chloramphenicol, option B streptomycin, option C tetracycline and option D all of the above. And the right answer is streptomycin. So Bacillus subtilis is used to assay of streptomycin. Question number 13. Which is the causative organism of whooping cough? Option A Vibrio cholera, option B Bacillus pertussis, option C Clostridium tetani, option D Clostridium novi. And the right answer is Bacillus pertussis. Question 14. Which method is used for testing disinfectant? Option A, phenol coefficient method. Option B, Rideal method. Option C, minimum inhibitory concentration, that means MIC. And option D, all of the above. It is the most common question in microbiology. All of the above. So phenol coefficient method, Rideal method, and minimum inhibitory concentration. These are methods for testing the potency of disinfectant. Question 15. What is the danger zone for bacterial growth in food? Option A, 10 to 60 degrees centigrade. Option B, 0 to 5 degrees centigrade. Option C, 0 to minus 18 degrees centigrade. Option D, none. And the right answer is 10 to 60 degrees centigrade, which is good for growing a bacteria. So it is called danger zone. Question 16. Giardiasis is a disease caused by which microorganism? Option A, virus. Option B, bacteria. Option C, protozoa. Option D, none of these. And the right answer is protozoa. Question number 17. Cold sterilization is done by using which process? Option A, gamma ray. Option B, Cobalt 60. Option C, Cresol 5%. And option D, formaldehyde gas. And the right answer is Cobalt 60. So cold sterilization, Cobalt 60 is used. Question 18. Operation theatre is sterilized by which component? Option A, bleaching powder. Option B, Cresol 5%. Option C, ionizing radiation. And option D, formaldehyde gas. And the right answer is formaldehyde gas. In hospital, there are many operation theatre which are sterilized by formaldehyde gas. It is most important MCQ. Question number 19. EXAME test confirm the count of which bacteria? Option A, E.coli. Option B, Staphylococcus species. Option C, Plasmodium species. And option D, Bacillus species. And the right answer is Escherichia coli. That means E.coli bacteria. Question 20. E.coli is used as a test organism of which antibiotic? Option A, chloramphenicol. Option B, nystatin. Option C, rifampicin. And option D, tetracycline. And the right answer is chloramphenicol. Question number 21. Ducrey test is done. Ducrey test is done for which disease? Option A, scarlet fever. Option B, hemophilus. Option C, syphilis. And option D, common fever. Ducrey test is done for hemophilus. So right answer is hemophilus. Question 22. Rose water test is done for which disease? Option A, tuberculosis. Option B, leprosy. Option C, diphtheria. And option D, rheumatoid arthritis. The right answer is rheumatoid arthritis. Question number 23. Which test is performed for the diagnosis of typhoid? Option A, SIC test. Option B, Dick test. Option C, Widal test. Option D, Elek test. So the right answer is Widal test. So in typhoid, Widal test is done. Question 24. Powder is sterilized by which method? Option A, gaseous sterilization method. Option B, moist sterilization method. Option C, dry sterilization method. And option D, formaldehyde gas. Right answer is dry heat sterilization method. Question 25. Anaphylaxis, that means type 1 allergic reaction, happens due to which antibody? Options are IgA, option B IgG, option C IgM, and option D IgE. And the right answer is IgE. Thank you for watching my video. Please like, share and subscribe.